there is a very important person from the University of Chile who participated in the group, who is Alberto Minoletti. Alberto Minoletti was during more than 15 years head of the Department of Mental Health at the Ministry of Health in Chile, and during his period he was able to put the mental health on the public agenda. So in Rio de Janeiro participate also the Federal University of Rio de Janeiro and these two units, the Institute of Psychiatry and the School of Collective Health. And from Buenos Aires participate a big old hospital, the José Tiburcio Borda, and a private community-based project that is SUMA. And I think here is one person now from SUMA who can tell us more about this project. From Córdoba, Argentina, participate the Universidad Nacional de Córdoba. It is the oldest university in Latin America, and there participate the School of Public Health. And Neuquén is a town or a city at the Patagonia in Argentina, and there is a very interesting private community-based project. The name is Austral Institute of Mental Health. And as I said, one person here in the audience was there. In Medellin, Colombia, participate the Public Health School of Universidad de Antioquia, and from New York, two persons that you know, Sandro Galea and Ezra Sasser. The main objectives of our hub is to improve the condition of people with severe mental disorders in Latin America and to develop practical and effective public health mental health services, to promote community mental health services that operate in a network with the rest of the local healthcare system, and build a cohesive, sustainable regional network of researchers. So our four tasks are to run a regional pilot RCT of an intervention for severe mental disorders, a capacity building program to build a regional network, and to include stakeholders in our project. So the intervention that we are going to run is based on the critical time intervention that is already tested and used in high-income countries. But our intervention is going to have task shifting. Is going to be led by two workers, a peer support worker and a community mental health worker. And it will be offered to the entry of mental health services. That is a key point of transition with long-term consequences. So the trial is going to run in 3 cities in Rio de Janeiro, Santiago, and Buenos Aires. At the first year is going to be run in Rio de Janeiro and Santiago, and in the second year is going to be run in Buenos Aires. It's going to be developed in community mental health clinic. In Santiago of Chile, the names are COSAMS, and in Rio de Janeiro, the name is CAPS, and in the outpatient center of Borda Hospital in Rio de Janeiro. The inclusion criteria are people aged 21 to 65 with psychosis and that are less than 3 months in the services. We are going to include 40 patients per site and their caregiver. And we are going to measure the variables at the baseline, 9 months after the baseline, and 18 months after the baseline. The principal variables are going to be quality of life and unmet needs, and the secondary variables service use, family support, auto-stigma, recovery, course of illness, and disability. We have a very interesting capacity building program. We aim to build a self-sustaining regional network of young leaders for the next years. We want to enhance the capacity of the hub site to devise, implement, and evaluate task shifting approach both within each site and across the site. And our mission is support young professionals from Latin America who have shown potential to become successful independent investigators in projects related to the mental health needs of the regions. For these purposes, we have already selected 7 awardees for the first years, and now we are going to select 5 awardees for the second year. Here are our children, like I said, and they are going to come in June to your summer school. But they already have have participated in many courses in Latin America at the summer school of the School of Public Health at the University of Chile, and in a very important epidemiology course in Lima, Peru. Yeah. Like I said, in New York, they are going to participate in the Summer Institute courses by the EPIC. And they have each of our awardees have 2 mentors, one from the Columbia University and one from one of the university in Latin America. Yeah? There is a big group in Chile from young investigators who are mentored from our PI, and there is the awardees who already participate in the epidemiology course in Peru. So, and we have already developed a regional connection between Santiago, Rio, Neuquén, and we have already many new connections. In the hub, we have a constant communication, bi-weekly or monthly meetings of various working, leadership, and executive group. We have also many in-person meetings in Buenos Aires, Rio, Córdoba, Santiago, and I said already some training here in New York. We have also a weekly newsletter. The name is Correo Semanal. Maybe you can receive it, or some of you already received it. And thank you. And the hub investigator already play a role in the mental health development in our city. We have all extensive research experience and have relationship with policymakers, scientific societies, and local mental health services. Yeah, in September, we are going to have a meeting in Santiago, and in connection with that International Autism Conference, there is also some project in stigma with some people who are here in the audience now, and thank you very much.